Hello and welcome to this week's episode of Health Business. The tradition on this program is to educate you on different health issues and new innovations in the health sector. I'm your host, Oluwatoyin Kolaole. First on the lineup is the news. Stay tuned.
Pharmacists in Nigeria, most especially community pharmacists, have been charged to be more proactive in their responsibilities and also thrive to be at par with their counterparts in other parts of the world. The advice was given at the commissioning of the National Secretariat of the Association of Community Pharmacists of Nigeria in Lagos.
Thank you very much.
The president of Pharmaceutical Society of Nigeria, Ahmed Yakasai, and the national chairman of Community Pharmacists, Albert Alkali, noted that pharmacy is evolving and pharmacists in Nigeria should not be left out. These pharmacists also used the opportunity to call on the federal government to implement the drug prescription law so as to curb drug abuse in Nigeria.
History was made today as a brand named MyMedicalBank was launched in Lagos. This brand is aimed at improving healthcare services and connecting patients to qualified health practitioners.
According to stakeholders in the health sector, it is important for Nigerian hospitals to tap into the benefits of information technology in order to change the face of medical practice in the country and to avoid being left out of global trends. This was the thrust of discussion at a symposium to launch a medical brand, MyMedicalBank. Founder of MyMedicalBank, Ayo Adebamowo, explained that the aim of MyMedicalBank is to improve how Nigerians can have prompt access to qualitative health care delivery.
MyMedicalBank, it's an idea that was conceived about 3 years ago. The vision behind it came about when I came to Nigeria. I live in the UK, but I do come to Nigeria regularly. So on one of the occasions that I came, my mom was ill, and one of the things we had to do was we got a doctor to look after her, come to the house. Now, in the course of the consultation, the doctor was asking mom a number of questions, but unfortunately for her, because of her health condition, she couldn't talk. We got a new doctor to look after her. She was asking a number of questions in order to establish her medical history. Now, unfortunately, neither I or my younger brother could provide answers to those questions, like her, diagnosis history and all that. So there and then, it occurred to me that it would have been a good idea if we have a platform, a secure platform, where that doctor could have logged in at that time and access mommy's health record, to enable her take over the care process for her at that time. So that's how the idea of MyMedicalBank came about. And then I went back to the UK and then I started thinking about it. And in addition to that, I started speaking with a number of doctor friends, both in Nigeria and the UK and other parts of the world, to say, look, this is an idea I've been exploring, providing a secure digital platform that will give healthcare professionals and providers an opportunity to be able to manage their patients' care pathway without the limitation of geographical constraints. So that's how the idea of MyMedicalBank came about.
Adebamuwa further noted that MyMedicalBank is an ICT-enabled system where patients' information are stored in a cloud storage system and can be called up in any part of the world, especially during emergencies.
MyMedicalBank is simply a secure digital platform that allows information about patients and the health information about users to be aggregated onto a single platform, such that wherever that patient needs to access healthcare, that information is accessible, even if they go outside of the country, as long as they authorize their medical provider to access their record, they will get the information they need. So that's MyMedicalBank in a very simple nutshell.
Speakers at the launch commended the efforts of the organizers and took turns to talk about importance on ICT in the health sector.
Doctors are expected to always bear in mind the obligation of preserving human life. At times, death is inevitable, but you should have been seen to have tried your best to return that person back to good health. Doctors owe his patients complete loyalty and all the scientific resources available to him. Whenever an examination or treatment is beyond the physician's capacity, he should consult with or refer to another physician who has the necessary ability. In essence, referrals. And I believe in this world of ICT, referrals are now done through ICT. Apart from referral through ICT, networking, exchanging ideas. About 3-4 weeks ago, the telemedicine center was inaugurated at Fairbairn University. Incidentally, our father here was present when this thing was displayed. The physicians in India was in touch with the physicians here. As the patients were being examined, whatever, as the results are being seen here, the results are equally being seen. So they were able to exchange ideas. That is the beauty of ICT.
And if you're able to put all the necessary measures in place to ensure that data of patients, the confidentialities of patients are kept, and even the professionals too, they have their details are secure. I think it's a very, very good idea in bringing the service of medical rehabilitation professionals to the needs of persons living with disabilities in Nigeria. We have lack of identity of medical rehabilitation facilities and centers in all the states of the Federation. If we're able to have this with the details of their location, talking about the directories, I am sure that it's going to go a long way to also help in resolving these issues. And when we have any requests from anywhere in the world, they can easily go to that MyMedicalBank and get details of where such services can be accessed.
Panel discussions was also set up to analyze the workability of the brand.
We need to start looking at a primary healthcare centric system that focuses on prevention of disease. And greater economies of scale when we look at our hospital systems, so that we can do maximum production in those hospitals with experts that are only really doing that procedure. So the reason that these guys are so fast and so safe and so efficient is because they don't do anything else. People think that medicine is some kind of magical thing, that there's a good doctor and there's a bad doctor, and that the doctors in the UK or Germany are just better. No, they're not clever in any way, shape or form. They're just doing one thing. I didn't train with an orthopedic surgeon in the UK, I trained with a hand surgeon. He's doing a maximum of 5 procedures for the past 25 years of his career. He can't go wrong. So what we need to do is have, and it brings down the price. When people are more efficient, you get less complications, lower, shorter stays in hospital, and it makes the healthcare cheaper. So what we need is a primary prevention-focused medical system with specialized factories, production lines for complex procedures.
I have been at the receiving end. I know how much it costs for me to buy data every week, every month, and the slow speed at which it works. So I'm paying for things that I cannot actually use. So the penetration is poor. It's very good in the cities, and that's where we concentrate on. Or just step out into the villages and into the nooks and crannies, you find that you cannot access email readily. That's one thing. Ordinary telephoning. Just don't pray that your car gets stuck in a place where is a lacuna. You bring out 3 telephones, 3 different service providers, and you will not be able to use any of them. There are too many black spots. The place is not properly connected, and it seems to be getting worse. This is the problem for me.
Medical experts at the launch of MyMedicalBank urged the federal government through the Federal Ministry of Health to key into this brand so as to strengthen healthcare delivery in Nigeria.
you